This is a Jet 24, Fox 66, YourErie.com special report.
Good afternoon, I'm Brian Wilk. We interrupt our programming to bring you a special report. Erie County officials are updating the community on the COVID-19 situation in the region. Today's virtual news conference is coming live from the studios of WQLN-TV.
We had 19 cases of COVID nationally, with none in Pennsylvania and none in Erie County. 1 week ago, we had 1,598 nationally, 22 cases within the Commonwealth, and none in Erie County. And yesterday, we had 8,054 cases nationally, 133 in the state, and 1 in Erie County. And finally today, we still only have 1 in Erie County. In the state, we have 186. So from 133 to 186 in one day in Pennsylvania. And nationally, 9,468 cases. That's up well over 1,000 cases nationally since yesterday. So these numbers should tell us all that we have a lot to do to continue to try to bend that curve and stop the spread. The positive message is that we can, and that we must do more to mitigate the spread of COVID-19. We can still flatten that curve, but that depends on you, the people of Erie County. So I am speaking strongly when I say we have to do all that we can do to reduce community spread. And the best tool that we have is what we've been referring to as social distancing. To achieve this, we have put all of the tools in place that we can. Bars and restaurants are closed except for takeout and delivery. We've asked non-essential businesses to close. Essential businesses that are open should work to reduce their staff working in the same building together. We're asking people to stay home. You can go out for a bike ride or for a walk, but keep your distance of 6 feet from anyone that you may encounter when outside your home. Because the testing is limited across the whole nation, we don't know how many people are infected here in Erie County. Therefore, the fewer contacts that you can make with others, the less likely that you are to spread or contract the virus. Now, I would like to speak to the younger residents of Erie County. It has been spoken that the younger people often will be symptomless or have very small chance of getting the virus. But what we do know with data coming back from Europe is that the younger people, those in their teens, their 20s, and their 30s, are super spreaders of this virus. When you are out and in groups, you, our younger people, are likely spreading the virus to others unknowingly. And then that person is likely to take the virus home to their parents, to their grandparents, to others in their circle who may be elderly, who may have underlying diagnosis of a disease or somehow immunocompromised. I beg of you to think of your loved ones, to think about those people that you care about, and to practice social distancing. You should not be in any group larger than 10, and in fact, smaller is better. I ask you to stay at home and use your great social media skills to stay connected to each other. I also want to speak to those who smoke or vape. If ever there was a good time to decide to quit, now is the time. Smokers and those who vape are at a greater risk of complications and even death if you contract this virus. Lastly, I want to say that our only tools left to stop community spread are extreme, and they are to shelter in place and to possibly close borders. We hope we never get to that point, but we have seen these measures implemented in other places across the globe and even in our own country. Again, I ask everyone to stay calm, to stay informed, to stay positive, and to continue to heed the directives and the advice that the professionals are giving us. And with that, I'd like to turn it over to one of our very competent professionals, Melissa LYON, the Director of the Erie County Department of Public Health. Melissa?
Thanks, Kathy. While our county executive spoke to you about the importance of our global response actions to prevent the spread of disease, my message may be a little bit more simplified. I want to talk to you specifically about our first case of COVID-19. The first case identified was fraught with mistakes and errors. It is critical that you understand this message. It is critical that the correct action be taken to prevent the spread of disease to other people. First, the proper precautions were not taken during the collection of the sample that was sent in for testing, therefore increasing the medical professionals' potential exposure to virus. Second, to our knowledge, the person tested was not informed to remain quarantined until test results were received. Hence, the person continued with some of their routine activities in the community. It is imperative that our community and the residents of Erie County understand that self-quarantine is one of the only tools that we have to contain the spread of disease. Third, the Erie County Department of Health was not notified that the person was tested. Unfortunately, we are aware that this may be occurring in other circumstances. Had the Erie County Department of Health been notified about the sample submission, our staff would have proactively responded in partnership with our health systems and providers to prevent the spread of disease to others. The Erie County Department of Health conducts disease investigations every day. With timely notification of potential infection, we are trained and equipped to take measures to stop the spread of disease. It is imperative during the early stages of this disease that Erie County Department of Health be informed when samples are submitted for COVID-19 testing. We as a community cannot continue to make these same mistakes as we fight the spread of COVID-19. We must come together, communicate openly, support each other with timely and accurate information so that we are making the best decisions for our residents and community. Lastly, I cannot stress enough that we must follow the directives of our public health officials in order to flatten the curve of COVID-19. With that, I'd like to hand it over to our next panelist.
Hello, my name is Rodney Buchanan from St. Vincent Hospital. Just to give you a quick update about what we've been doing at St. Vincent. We've started a new screening process for all visitors and ED patients coming into our facility. You're being asked about international and domestic travel to any known areas of disease and have symptoms of fever or cough. If you're an ED patient and you screen as a high risk, we are actually now directing you to a new area of our emergency department. You'll see a yellow tent outside of our ED. That's where we're trying to keep the segregation of those with suspicion versus those without suspicion. We want to inform everyone of this as we understand it is inconvenient, however it is also necessary. If you're a visitor and you have a high-risk screening, you'll be asked to wear a mask. However, we are considering further visitor restrictions in the near future as this continues to escalate throughout our state. The reason for the separation of the higher risk patients is to prevent the potential spread of any disease. Starting tomorrow on March 20th, we'll be opening up our drive-through clinic at our West Side location at the West Side Pavilion. This is a drive-through testing center for AHN patients who have an appointment and have been appropriately screened via telemedicine or through your primary care physician. If you do not have an AHN primary care physician, we're asking you to come to the emergency department. You should not go to the drive-through center if you have not already had an appointment with our AHN physician, as they will not be able to test you as you need an order from that physician to receive that test. The hours of operation will be 8 a.m. to 5 p.m. Thank you.
Good afternoon. I'm Doreen Summers from the Erie Veterans Affairs Medical Center. The Erie VA continues to have no confirmed cases of the coronavirus. We continue to actively screen all of our veterans visitors, and we have limited our visitation for our veterans in our community living center, allowing only hospice and palliative visitors if needed. All elective procedures have been reviewed for medical and clinical necessity, and those deemed non-emergent are being rescheduled as the Erie VA continues to take proactive precautions to protect all of our veterans, visitors, and staff. We are also suspending our walk-in clinics with the exception of our urgent care clinic and rescheduling non-emergent appointments in many clinics, including our primary care, our dental, optometry, nutrition, and many others. We continue to offer veterans virtual care and telephonic care as needed for any routine appointments. We encourage veterans who have appointments at the Erie VA Medical Center or any of our community-based outpatient clinics to contact their primary care provider and their team to arrange alternatives. As of this week, we are asking our veterans to only bring one visitor with them to their appointments at our medical center or our clinics to aid in social distancing. Thank you.
Good afternoon. My name is Emily SHEARS, and I represent UPMC Hammett. We would like the public to know that UPMC as a system and UPMC Hammett and all the hospitals have been preparing for months. We feel very well prepared. We have our active screening process still in place. We have also put visitor restrictions in place as well. If you are calling your primary care office or would like to have medical screening done there, please talk to them about using a telehealth or a My UPMC or UPMC Anywhere Care app to can have a telemedicine visit with them. We will be having a collection center. The construction will be completed this weekend and operational next week. We have educated staff that are in current training for specimen collection. This building will be located in close proximity to the hospital and have 8 negative airflow capable collection rooms with trained staff, and those presenting to this center will need a physician order from a UPMC physician. At this time, we would like everyone to know, again, to wash your hands. If you are ill, stay home, and make sure that you enforce social distancing. Thank you.
Good afternoon. My name is Becky Dawson, and I'm a member of the faculty at Allegheny College. I'm an epidemiologist by training, and I think you've heard a lot here. In Crawford County, where our home is on Allegheny College is in Crawford County, and we have not yet seen a diagnosed or confirmed case of COVID-19. However, we are messaging the same thing that you've heard everywhere here on the stage. I think a couple of other things to remember as we go through here is that the exponential growth that you heard about right at the beginning of this broadcast is real, and we're seeing the numbers escalate. And so we need to all think about how we can prevent transmission. We were talking a lot about hand hygiene and not giving ourselves any sort of disease before, but now we need to think about preventing us from transmitting the disease to others. So social isolating ourselves, making sure we're social distancing is really important. I'd also like to recommend that we check in on those that we love. There's a lot of high school seniors, college students who have had their school year come to an abrupt end, and it's sad, and they're learning how to take classes online and do things differently without the support of teachers, faculty members, and friends. So reaching out, touching base with loved ones. I think also recognizing that a lot of us are scared. There is influenza, there is regular common cold going around all of our communities, and so using the things that we have access to, whether it be calling our physicians' offices or calling and using telehealth, but there's also free resources available. So the Pennsylvania Department of Health has a 1-877 PA health number that you can call to ask questions for. In Meadville, the medical center has set up a flu clinic that is open from
8 to 8:30, Monday through Friday. It's by appointment only, again, so that you're not walking into the medical center, into their clinic, and trying to get care. But you can schedule an appointment, get seen, get tested for, whether it be for strep throat or influenza. But we really encourage you to maybe slow down and have the conversations first, and then go in and get the testing that you might need. Thank you.
Monsignor Rubino from LECOM Health. Just a few specific updates. Milker Community Hospital and Quarry remain closed to visitors. The ER rooms in both facilities are busy, but they're able to handle the patient traffic that comes through. All patients coming to those ER facilities will be screened. We have no confirmed cases to report. Visitors are also not permitted to our LECOM Senior Living Center, LECOM Nursing and Rehab, and LECOM at Village Square. And finally, I want to re-emphasize on behalf of LECOM Health what the county executive said to the young people of Erie County. This is serious. This is deadly serious. So please respond to what people are telling you to do. Don't take this home to your grandmother, your grandfather, your mom or dad, your aunt or your uncle. This is deadly serious, and you have to take it in that manner. Thank you.
I want to thank all that are with us today. I did want to tell our viewers that this is a virtual press conference, so the press are not in this room. We limited it to 10 people maximum in this room, and as you can see, we are all trying to keep our social distance from each other. So with that being said, we're going to start the questioning from our media. I'm going to give each media a chance to ask a question, and then we'll just kind of open up for general questions after the first round. So I'd like to start with the Erie Times News. If you could identify who is asking the question, we'd appreciate that.
Sure thing, Kathy. It's David Bruce from the Erie Times. I'd like to ask Melissa a little bit more about the mistakes that were made with the process with the first person in the county with COVID-19. How many, is there an estimate on how many folks were exposed due to that? And then also, what has happened with the medical professionals that were exposed?
So David, I appreciate your question, and at this time we're still gathering that information. As I had indicated, we are very much professionals around our disease collection methods and are in collecting that information. And so, to be honest with you, I don't have exact numbers. We've been following up with all of those that we believe may have been exposed to the virus. And then the great news is we're getting to them early, and then we're giving them the appropriate recommendations, such as quarantining themselves for the 14 days and monitoring their symptoms. And we'll continue to do that. But without knowing those numbers, I can't release those at this time.
And can you get into what mistakes were made specifically?
Related to not using proper technique, it had to do with some personal protective equipment not being utilized, and as well as some distancing from the individual when they presented at the place of collection.
All right, thank you, David. Now I'd like to ask Erie News Now, and please identify who's speaking.
Kathy, this is Paul Wagner from Erie News Now. I also wanted to ask about that first positive case, asked Melissa. The person was not informed that they should have been quarantined. Any idea how long that time period was when that person was out in the community, how many people they may have contacted?
Sure. So to our knowledge, the individual was not notified that they should self-quarantine until the results returned from the COVID-19 testing. We believe the individual, for the information that we've collected, remained home for a number of days while they were symptomatic and did not move into the community until they began to feel better. The number of people we are tracking down still and having communication with them about the next measures they need to take to protect themselves, their family, and their loved ones.
Okay, thank you. I'd like now ask WJET TV to please ask a question.
Hey, it's Samir from Jet TV. So I was just wondering if we were able to know exactly what part of the county this individual lived in or where they were active.
We're not revealing that. Obviously, we are concerned about the individual's personal protection and privacy, and so we are not able to reveal that. Erie Talk Radio, do you have a question? Hearing no question there, I guess I'm just, I don't know if there's any other media entities on the phone. Otherwise, we can just open up to everyone for more questions.
Sure. Kathy, it's David Bruce again. Want to talk a little bit more about the supplies that the hospitals have. Are you and Melissa and those at the health department, are you guys satisfied with the number of beds available in Erie, specifically the number of ventilators? Do you know how many there are? And are they a sufficient number if we're to see the number of seriously ill people that some projections have us seeing?
Yeah, this is Melissa LYON, and I had indicated earlier in the week that we are in what we consider full incident command structure. And what that really means is we have a number of branches that are collecting intelligence regularly, reporting back to the command center, the incident commander, and keeping that intel close at hand. Each hospital has a reporting system and mechanism on when we request that information, what that begins to look like. I'm not divulging numbers at this point. Again, I say information's coming in every day. I will default to the panelists if there's anyone in the panel from the health systems that would like to add some value to my comment.
I will say one thing to that we have heard the advice and certainly ask everyone in this community to look at canceling any elective surgery, anything that's not necessary at this time, so that any supplies that we do have would be kept and stockpiled for when the need, we believe, will grow in our acute care facilities for those supplies. So that has been a recommendation that we've seen on a national level, and that would include veterinarians and anyone who is involved in any kind of health care that's not necessary at this particular time, that was more elective, that could be postponed until after we've passed this crisis with the pandemic.
Kathy and Melissa, it's David again.
Yes, David.
I just want to follow up and make sure I'm clear on this. You're not divulging the number of critical care beds and ventilators because you don't have a firm number on it, or is it I want to know. I just want to make sure I know the reason behind that.
We do not have a firm number on it. Obviously, we know we have great healthcare facilities in our community, and of course, they're part of even larger systems. And so, when you look at their resources, I think it's even beyond what we have locally. But it's what do they have in their system to be able to move things as they might need to. I'm speaking really just from a general perspective, not with any real data behind that. But with that being said, I don't think it's any secret that nationally there's a real concern on do we have enough beds, enough equipment to take care of what could potentially be a very, very high need. And that goes back to the point that we need everyone in this community to help us, what we call flatten the curve, so that the people coming to the hospital do not inundate the systems to a point where they cannot handle them. So it kind of goes to the whole message of today is the more people social distance, do this for these 14 days, we're going to be able to reassess where we're at as a community and as a state and a nation, and I think that will give us a much better perspective on where we are in terms of being able to treat those that will come forward. But it's really up to the people of this community. Our systems, for the most part, are well stocked and have great facilities and have the life-saving equipment that we normally need. But this is not a normal situation, and this is why each one of us has to play a part in making sure that they are not at a point where they wouldn't have what they need to take care of us.
Kathy, this is Paul Wagner at Erie News Now. I just wondered, has both UPMC Hammett and St. Vincent stopped all elective surgeries? And if not, why not?
I'm going to leave that up to the two representatives to speak to that.
Hi, as far as UPMC, we recommend that elective procedures for those who are at higher risk should be delayed only when it's clinically safe to do so. And we continue to serve our patients whose procedures our clinicians believe are not medically responsible to delay. We are leaving that up to the individual clinicians.
This is Rodney at St. Vincent. We have also stopped all elective surgeries that are not medically necessary at this time to preserve both nursing staff and personal protective equipment, and that started this week.
And I thank those systems for doing that. You know, I think one of the things we're showing here with this press conference, and we had, you know, an earlier one this week for the media, is that our community health care providers and your community public health system, we are working collectively together, and that's obviously what we need to be doing to be able to fight this as a community. Other questions?
Yes. Yeah, hey, Kathy, it's here with TV. I was just wondering, are we able to know exactly where this person was tested? Were they tested by a private doctor, or did they receive their testing at a hospital?
I'll let Melissa, do you want to address that?
So my global answer to you is that there is the opportunity for private physicians to do testing once the commercial labs came online. The message from the state health department throughout the entire Commonwealth was that physicians no longer needed to have their approval to submit to the Bureau of Labs. What this results in is physicians throughout the Commonwealth having the ability to submit samples to the commercial labs without communicating with their local health department if they have one. Here in Erie County, we have a local health department. We've worked very hard, and I'm here to say that we have really great working relationships with our healthcare systems and our providers. But this particular message that was put forward during a time when testing became available, I think became confusing for what we wanted to see happen in Erie County versus what was happening throughout the rest of the state. And remember, many counties do not have local health departments. So with that being said, it's resulted in this scenario that played out for us here in Erie County.
Right, so was it tested at a hospital or like a primary care?
It went through a physician's office.
Okay.
I heard someone else who was trying to ask a question.
Yeah, this is Maddie O'Neill from the Erie Times. Is there anyone there who can speak to the precautions being taken to protect inmates and staff at the Erie County Prison?
So, thank you, Maddie. In terms of the Erie County Prison, you know, we have we've ended visitation to the prison. There is ways for our prisoners to have virtual visitation with their loved ones. And we certainly have had issues with the flu at the prison, so we've tried to isolate, we have isolated those individuals. And at this point, we don't have any active cases and no symptoms of COVID-19 in the prison, but obviously we are taking all precautions with cleaning and social distancing as much as you can within that type of facility, and everything else that we can do to heed the advice and the recommendations of the healthcare professionals. And we'll continue to do that going forward.
Are incoming inmates being screened or quarantined in any way to prevent the spread within the prison if someone comes in who's maybe asymptomatic?
Everyone who's coming into the prison right now is being screened for temperature. And so that's what we are doing at this particular time.
It's David Bruce.
Maddie,
David, hang on one sec. Are there any efforts being made to, are there any efforts being made to reduce the inmate population or maybe identify medically at-risk inmates who could be eligible for release?
Well, that is not under the jurisdiction of the county administration. And, you know, we simply house people once the court system decides who goes to jail. So that would be a question to take forward to our courts, to the president judge and his team.
Okay. This is Dawn Kemper. This is Lisa Adams from Erie News Now. I'm on the call as well.
Yes, Lisa.
I had a question. There are some people who've talked to me who think that there hasn't been testing going on in Erie County because the test supplies are so limited. So I wondered if the reps from AHN St. Vincent and UPMC Hammett could each talk a little bit about how much testing they've been doing so far, and have they been doing that in negative airflow rooms within the hospitals, and then why it's desirable for each of them to move Hammett to a building with 8 negative airflow rooms and AHN to the drive-through situation.
You may have to repeat the second part. This is Emily SHEARS from UPMC Hammett. As far as the first part, any patient that has met criteria, and criteria is ever evolving day to day. So each patient that we evaluate, that we have concern, we have tested. We have done that following the CDC guidelines in a negative air pressure room with an N95 fit tested respirator, eye protection, gown and gloves. The Category B specimen collection protocol is also followed for that. So all of our testing has been completely safe. Our collection center will also have 8 negative airflow rooms. All of the staff will be in the CDC recommended airborne contact eye protection precautions as well. As far as numbers, we are not disclosing how many patients we have tested up to this point, but we are actively applying that criteria, working with the state, working with the UPMC system and the Erie County Department of Health to appropriately triage testing. We have the ability to collect. It is a routine universal transport media nasal swab, as long as the environment and precautions are followed appropriately.
This is Rodney from St. Vincent. I also can't disclose the amount of patients that we have actually screened. However, we have screened several per day that have been coming in that have met criteria of either travel or domestic contact with COVID or suspicion of COVID with symptoms. Those have been done with proper CDC recommended guidelines for specimen collection, and we have been using our negative air room for that at St. Vincent. The area that I talked about earlier with the tent, you'll be diverted off to a secondary area of the ED that has also been made negative air as well for specimen collection.
Lisa Monsignor, Rubino from LYON. We don't disclose the number of cases tested, but we followed all the appropriate guidelines from CDC when and if we do those.
Thank you. I'm still surprised about the test being able to be done by a physician's office that wasn't protected, because I really thought that all testing up until recently had to be approved by a local health department or the state epidemiologist to meet the criteria. So shouldn't a physician's office have known that?
So this is Melissa, and I had indicated that earlier on in the development of testing coming online, with the hopeful outcome of having more broad testing capacities, the message was put forward that physicians could put tests into the commercial lab system without requiring to contact a health department or the Pennsylvania Department of Health. The Pennsylvania Department of Health and the Erie County Department of Health, we approve all samples that go to the Bureau of Labs. So that's the state laboratory system.
Melissa, about how long ago did that start?
I love the timelines. I think there's been, not to be too humorous around this, but I, don't know Monday, Wednesday, Thursdays, or Friday. Okay, so I'm getting, I'm phoning a friend here, and in the back panelist, I'm hearing that would have been about 5 days ago.
Okay. Melissa, it's David again. Can you comment at all on the quarantine situation with the 145 students at Mercyhurst? The health department ordered that, if I'm not mistaken, if that's the right terminology. How is it being enforced? Is that strictly Mercyhurst, or is anyone else taking a role in enforcing that quarantine?
So Mercyhurst is definitely the lead on the communication with the individuals that have been asked to quarantine, and then they as well are the front lines on continuing to get compliance with that. We were hoping our message today is reinforcing the message that Mercyhurst has received from us, that this is very serious and they absolutely must quarantine, otherwise we are not going to contain the spread of COVID-19. I really do not want to stand up here in a few more days or in another week and tell you that this is beyond our span of control. And I don't like having to have this conversation right now, but I think it's so important to hear that. As far as the enforcement, I've mentioned to you that we are in full incident command structure, and I can assure you we are building out components that are investigating different methodologies that we may be able to deploy to begin to enforce social distancing, quarantines, non-essential businesses to close their doors. This is so entirely serious that, as Kathy had mentioned, we have only a few more options, or tools in our toolbox, to stop the spread of this disease, and they are drastic, and they are everyone will shelter in place, there will be strong enforcement, and last but not least, you close the borders. And we do not want to go there. We do not want that to happen in Erie County. We are hopeful that right now we have the ability to get the contacts, have people comply, and get this thing where we can still manage it. And I cannot stress this enough. If this message is not put forward today, it's going to be the same message you get the next time you hear from me, and it's going to be the message you get from me moving forward. Thank you.
This is Joel Natale. Can you hear me okay?
I can hear you, Joel.
Oh, thank you very much, Mrs. Dahlkemper. On Monday, SHAR had the number of negatives. That was at 11. I mean, that's where we were at on Monday. Do we have that number today? How many negatives that have come back?
We do not have that number today.
And just one follow-up, as far as, is there such a thing as a stockpile of protective gear for our healthcare workers that is always kind of in the hopper, if you will, for times like these?
Okay, we're looking to see who might want to speak to this. Melissa will come back.
I think I drew the short straw today. So it's called the Strategic National Stockpile. It is something that was put in place decades ago for certain responses, in particular around other types of disasters. I apologize. I wasn't expecting the Strategic National Stockpile question, but yes, they are stockpiles in undisclosed locations throughout the country. And I know virtually nothing about the details of the Strategic National Stockpile, so I don't think additional questioning is going to be at all helpful. It's a very...
No, I'm not interested in the national. I'm just wondering if it's protocol for the healthcare providers to always have kind of a stockpile in their systems. I guess that's where I was coming from.
So as far as a protocol, I'm unsure of any required regulation around that. I know the UPMC system, we do have what we call an alternate stockpile that we are rotating right now, and so we are very closely monitoring all of our personal protective equipment and will utilize that if necessary.
Just in response to the question, on a very practical level, we were short on testing kits and swabs in the middle of the week, and St. Vincent's and Hamlet helped out Mill Creek Community Hospital. So there's a wonderful sharing with those two facilities and us in that particular case, and I really want to thank both of those systems.
Okay, I heard someone else wanted to come up with it. We can have time for maybe one or two more questions.
Kathy, this is Paul Wagner at Erie News Now. I wanted to ask Melissa just to clarify the time period between the person who tested positive for coronavirus when the test was submitted versus when that person self-quarantined. How long was that time frame?
So it's approximately 5 days, but I I want to say right now that focusing on this first case is the Erie County Department of Health's responsibility. And the additional detail around who it was, where they live, where they traveled, who they've been exposed to, that's the Erie County Department of Health's job to collect that information. And we will follow up as our protocols are for all infectious diseases that we do. The value I really want this media team to be doing moving forward is helping us contain the spread of disease through our social distancing measures and the things that you can be doing to put the appropriate measure forward. I don't mean to be rude about it. I just want to be very strong in my messaging on what's important information that they all have. We will take care of the disease investigation and control of this quarantine as best that we can with the span of control that we have right now. Thank you.
Melissa, hey, it's Samir from Jack talking again. So I guess really quick, are you able to break down, I guess, the people who did come into contact with that patient, I guess, from a health care standpoint, like how they're doing? Or I know you don't want to dive too much into that specific case being the first one, how that person is doing. Can we get an update on them?
At this point, everyone is doing well and non-symptomatic, and I'm really going to stop answering questions around the specific first case. I think we've given you quite a great deal of information, and I think that's appropriate at this point. And I don't mean to
Well, I mean, we don't know where they're at, so I think it's kind of the public concern around that is high. I mean, I would like to know if I lived near that person, if I was someone in that area. So I do think that's important for the public to know. I'm not asking for a specific address.
Yeah. So the Erie County Department of Health is taking care of how we notify those individuals that may have any exposure.
So I just want to...
Melissa,
go ahead. One more. This is the last question.
It's David. It's back to Melissa. Just to get back to the quarantine situation at Mercyhurst, I just point blank, is the health department satisfied with how the quarantine's been done there?
Yeah, we're very confident in the communication that we've been having with Mercyhurst and the actions that they've been taking to assure that that quarantine is taking place. Yep, we're very satisfied with that at this point. Thank you.
So I want to thank all of our healthcare providers who came up to be with us here today. I want to thank the media who continues to cover this. I thank you for getting the message out. And the important message is that there are carriers. We certainly think, we believe that there are, and I don't think we're wrong on that. There are carriers out there spreading this virus because they're not social distancing in our community. And that's what we need people to stop. So please, stay home, stay calm, stay informed, heed the directives of your healthcare professionals, and we as a community will get through this. I want to thank everybody who's doing the right thing, and please help those who aren't understand why they need to do it too. Thank you.
And you've been watching a live update from Erie County health and government leaders on the COVID-19 virus in Erie County. Now, in case you just tuned in, here are some highlights of what was discussed. We first heard from County Executive Kathy Delcumper. She said that she did a lot of reiterating. She mentioned we must do more to prevent the spread of the virus. The best tool, obviously, is social distancing. She did say we do not know how many are infected in Erie County. And she did mention that smokers and vapors, they are at a higher risk of death or serious injury to the disease. And we also heard from the county health department, Melissa Lyons. She mentioned that the first case of COVID-19 in the county, sample testing was not done correctly, and that person that was tested was not notified to stay quarantined while the results were coming back. She also said that the health department, they were not notified that the person was tested, and had they been notified, they would have taken different actions, obviously. And we also heard from several hospitals. St. Vincent, they mentioned they're starting a new screening process. The Erie VA mentioned that they have no cases of COVID-19, and they're only allowing one visitor at a time. UPMC mentioned they are also having visitor restrictions. And LECOM Health, they said that their ER facilities are open, but they are very busy, and they do not have any COVID-19 cases at this time. So we'll have the latest updates on COVID-19 anytime on YourErie.com, and a complete wrap-up of the latest developments tonight on Jet 24 Action News beginning at 5. We now return to your regularly scheduled programming. Good afternoon.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to yourerie.com. We now return you to your regularly scheduled programming.